how are you? Good. How's your week been so far? Good, excellent. First things first, I did just want to say thank you for coming in at such short notice. It's been a bit hectic here at the practice because basically we've developed quite a thorough screening process for this virus that's been going around. And so what we've been asking patients to do is, when they can, come in and just take part to make sure that there's absolutely nothing to worry about. I'm sure there won't be anything to worry about, but it would be remiss of us not to follow up. And secondly, I just wanted to say apologies for wearing such a vile tie this morning. I've been on call all night and haven't had a chance to change, and I didn't really pay attention when I was getting ready this morning. So apologies for that. So basically, we got the results of your swab back from the labs, and there's absolutely nothing to worry about, nothing wrong at all, but it did appear that you might be a little at risk of getting the virus. So we wanted to get you in just to do, as I said, a thorough screening process based on some of the information that we now have about it. So, as usual, just to make absolutely sure that it's you, can I just confirm your name? Full name's fine. Date of birth. And the postcode of your address. Thank you very much. So, today we'll just be going through a few very basic tests. Basically key points that we've found are contraindications to having the virus, essentially. So this will include just basically checking your face, as usual. I'll take another swab to send to the labs to check your immune system. We'll then be checking your heartbeat and your breathing, as we have done before. I'll also then be checking pressure points on your skull to ensure that everything's okay. Then I'll be taking a quick look at your lymphatic system to make sure that that's all working a-okay. Then we'll just be doing a very, very quick free radical test, and I'll explain more about that when we get to it. Following that, we'll be doing some eye examinations. So that will involve testing the reaction speed of your eye, before and after a colour blind test. Okay? And we just found, obviously, colour blindness is generally patrilineal, so it's a male issue, but it can affect women too sometimes, so we need to be as thorough as possible with that. Then I'll be checking a few pressure points and nerve reactions, very simply with some odds and ends, and having a look at your face one more time, checking your skin tenderness, and then that's it. Does that sound okay? So as I said, it's quite a thorough series of examinations, but I think it's better to be safe than sorry, and we want to make sure you're absolutely fighting fit. Okay? Good. Again, thank you for coming in. It's for everyone's good, to be honest, because this virus could spread if people walk around with it without knowing. But without further ado, we will get going. Okay, so I'll be writing notes at every juncture. Just going to pop on some gloves. Let's see how quickly I can do it this time, eh? I think my record is about 10 minutes for getting them on. Alright. How are you feeling generally? Yeah? Well, the weather has been a little bit temperamental recently, and that can cause your body to react in ways you might not expect. Okay? Let's take a quick look. Look at that. Did you time it? Good. So we're ready to go. So first of all, I'm going to just generally check your face. And to do this, I'm going to look at symmetry. So across the brow, down your nose, across the mouth. Now, as you know, the mouth should be aligned roughly with the base of your earlobes. So if we look across there, I can see quite clearly that everything seems fairly symmetrical. Everything seems balanced. Across your brows here, just across here, it should be pretty straight too. Now you can cause yourself headaches and stuff by frowning a lot, so I recommend try smiling. And just working along your face, we can see that your skin looks in pretty good condition. You look well hydrated, although I would always recommend you drink water. And just generally checking down the musculature of your face. Doesn't seem to be anything too bad. Now what I'm doing here, just feeling around for a baseline, so that after we've completed the tests, I can go back and make sure that everything is the same. It's a control sample, if you like. Okay, so I'm just going to make some notes. Okay. Now again, as mentioned, I'm just going to take another quick swab. So if you open wide for me. Okay, bear with me. Okay, perfect. And I'll send that down to the lab in a jar, and we'll get it tested out. Okay. Now, if you just do a couple of things for me, if you just say "ah" for me again and stick your tongue out really far as you can. So "ah," and then stick your tongue out as far as you can. Okay. Okay, good. Okay, put your tongue away. Okay, and now I'd just like you to grit your teeth and give me a smile, okay? So gnash your teeth together and let me have a look at the gnashes, alright? So, okay. Okay, well there's no inflammation in your gums, I can see, which is good. One of the indications of the virus that we've seen is that there's a tenderness in the gums and sometimes a whiteness or inflammation. But I can't see any of that with you, which is good. Okay, just scrunch up your eyes for me. What I'd like you to do, very quickly, is blow out your cheeks, like a pufferfish, as we've done before. Okay, good. Now furrow your brow for me, please. As if you're glaring at me like you want to punch me in the face. Okay, good. Just very quickly open your eyes and look from side to side as quickly as you can. Okay. And also very quickly, what I want you to do now is lower your head to your chest with your chin. Yep, like that, good. And now raise your head as high up as you can, as if you're looking up at the heavens. Okay, excellent. And now quickly turn to your left and turn to your right. Okay, brilliant. Thank you very much, that's good. That's all looking good. Some of the things we've also noticed is a bit of a slowdown in response times in terms of the mobility of the upper regions of the head. And I can safely say that you haven't exhibited any of those symptoms, which is good. So, now we've done this before, this next part. What I'm going to do, pop on the old Stephs. You know how I feel about these. And I'm just going to check, first of all, your breathing, and then I'm going to have a little listen to your heart rate as well. Okay? So don't shout or anything, because these things are really sensitive and it can give me a massive headache. Okay? I'm just going to get in very closely and listen to your breathing. Okay, and if you can just breathe in, hold your breath, yep, 1, 2, and exhale. I'll do it with you if it's easier, okay? So breathe in, hold, and breathe out. Okay, another time. Breathe in, hold, and breathe out. Perfect. One more time, just for luck. Breathe in, hold, and breathe out. Okay. Good. That wasn't too bad, was it? As I said, we've done a lot of these tests before. We just have to be as thorough as possible. And there are a few more that we haven't done yet. Okay? So again, same deal as before. I'm just going to check your pulse and count along to it to make sure that you've got a good resting rate. Okay? So let's do your right wrist first, okay? Okay, good. And your left wrist, okay? Okay, good. Okay, so what we're looking at there is about 70 BPM, okay? Which is fine. Right, very quickly, this might seem a bit draconian, but trust me, it is still kind of work. And we're going to test for iron levels in your blood. And the way I'm going to do that is actually just going to pinch the end of your finger like this on each hand, like that, just for a few seconds, and let go. And then what I'm going to do is I'm going to observe, you know when you pinch your finger it goes white. Have a go now, have a little look, hold it for a bit, let go. It goes a little bit white. The longer it takes for that to sort of stop indicates the level of iron in your blood. It's a good test for anemia. Now it's not a replacement for a standardized anemia test, which is where we take a sample of your blood and plop it in a solution, and then if you've got a good iron level, it actually turns to iron. This is a very easy key indicator for me to have a look at. So give me your hand. That's it. I'm just going to squeeze the end of your finger. Okay? Shouldn't hurt. And let go. Okay? And in your right hand, please. Just very gently holding it. And letting go. Okay, good. I don't think there's anything to worry about there, but what I will do, just squeeze a few bits on your face to make sure that the same level of iron is reaching the capillaries in your facial region. Okay? So very gently squeeze. Pinching your cheeks. And let go. Good. Alright, that's absolutely fine. Just very quickly, I'm going to be putting my hands over on your head and pressing down gently on your skull to make sure that there's no softness or any tear away or any kind of abnormal lesions or polyps or anything. Okay? So very close, and don't worry, it shouldn't hurt a bit. Okay? Just up and over round. Do you know the bits of your brain? So I'm going to work my way back around. In the middle you've got your medulla, yeah? Now I'm not a psychiatrist or any kind of brain surgeon, I'm afraid, so I don't know that much about it, but I know that you've got your hippocampus up here, your prefrontal lobes in the very front of your head. We need to make sure they're okay, alright? Don't worry about a thing. It's all feeling very good. No, this isn't phrenology. That's a discredited pseudoscience. Okay, good. We're looking good there. Fantastic, thank you very much. Negative. Alright. Now I'm going to check your lymphatic system, and I'm going to do this by checking the cervical lymphs, which are there, the glands under your throat. And the lymphatic system is kind of an excellent early warning system for illness. So if you imagine that if you're feeling a bit run down and it doesn't seem to be getting better, if you check your cervical lymph nodes just under your throat, here, if they're inflamed, it's a pretty good indication that your immune system's feeling a little bit low and it needs a bit of extra help. To decrease the inflammation, what you can do is take anti-inflammatories like ibuprofen, or you can gently massage the region around the lymph nodes. Okay? And that just helps to disperse some of the fluid that's built up and can soothe any aches or soreness brought about by the cellulitis around the area. Okay? Now, of course, if the problem persists, come and see me or any other doctor to make sure that nothing serious is wrong, but it's a really good system that tells you if something's a little bit up. It's a good indication if your immune system is having a tough time, essentially. Okay? So I'm just going to gently massage your cervical lymph nodes. And there doesn't seem to be any inflammation, which is good. It'll always be a little bit sort of hard, but that's okay, because sometimes it's just your immune system doing its job, alright? But feeling around here, your cervical lymph nodes, it's a bit of a funny name, I know, considering the location. Okay, absolutely fine. Okay, good. Now what we're going to do, let's take a little spray. This is to test for free radicals, and free radicals are the kind of thing, if you smoke, they kind of build up and they can have negative effects on you, and this mist we've developed can help us just to see a general broad strokes picture of what the situation is. So I'll shake it up and spray it, okay? What this tells me is basically what's going on with the free radical situation around your head. Okay, it's looking absolutely fine. That's what we're going to do now for a quick eye test. You know this test very well. It's quite relaxing. I shine this into your pupils and I test the reaction speed of the iris, the aperture of the iris. Okay. Good. Alright, so we'll do one test, then we'll do the colorblind test, and then we'll do another one of these. Okay, we'll also do a bit of following the penlight as well. So I'm just going to shine this in. You ready? We'll start with lefty. Ready? Oh, I'm mucking that up. Okay. Good. It's very bright. I'm just going to root down at this. Hello, and off. Hello, and off. Hello, and off. Alright, let's do righty. Okay, good, looking good. Good. Ooh, good. And hello, and off. Hello, and off. Hello, and off. Okay. I'm sorry. Okay, now just follow the light for me. So first of all, what we're going to do is you're just going to look at my tie right in the middle here. And I'm going to move it from side to side, and you don't follow it, alright? Okay, good. What we're going to do, same again, but this time you're going to follow the light with your eyes. Don't move your head. Keep your head stationary. But just follow the light with your eyes, okay? Here we go. So just very gently follow the light. You shouldn't feel any discomfort, but your eyes might start to get a little bit tired as we go on, okay? There we go, that'll do. We'll do that again in a minute, okay? Next, I'm pretty very familiar with this. It's the Ishimara colorblind test. Now what I need you to do is basically tell me what you can see in each circle. So we will start with this side. What can you see in this one? Okay, and the next one? And the next one? And the next one? And the next one? And the next one. I'll flip it over. From the top, what can you see? And the next one. And the next one. And the next one. And the next one. And the other one. Okay, good. Right. What we'll do, just very quickly again. Have another go with this, and then check that test again, okay? So same as before. Lefty first. I won't say hello this time. Okay, and righty. Okay, good. Right. Same test. Now, can you tell me about the first one? Second? Third? It's okay, there's no wrong answers. It's not a trick question. Fourth? Fifth? And sixth? Other side. First. Fourth. Second. Third. Fourth. Fifth. Sixth. Okay, how was that? Did you find that okay? Alright, good. Right. Just going to check some pressure points and nerve reactions really quickly. Do you feel that okay? Yeah? Okay. Okay, thank you. Just going to take another quick look at your face, check the symmetry again. So across the brow, down your nose, like this, yeah? Checking for symmetry, checking for facial droop, any signs that might indicate either some kind of condition or illness, okay? Down the sides here, checking the line from the top of your mouth to the earlobe, and from the top of your nose to the top of your ears, okay? You're looking very, very symmetrical still, which is good. Okay. Just want to check your skin tenderness very quickly. So what I'm going to do, I'm just going to poke you. very, very lightly, it shouldn't hurt, okay? And the other side. Okay. Okay. Well, I'm not seeing anything particularly worrying. Okay. What I will recommend is that you drink plenty of fluids. Okay? Yeah? And just take care of yourself. Make sure that you don't get run down. So try to relax, for one thing. Okay? And also, if you feel, just give your lymph nodes a massage every now and again. If you feel them getting inflamed, I'd recommend coming in and booking an appointment, okay? Just to make absolutely sure. Otherwise, you seem fit as a fiddle, right as rain, Okay. Thank you so much for coming in today. I do realise it's a bit frustrating having to be summoned to see your doctor, but I hope at least you can leave feeling a little bit more confident that everything's okay, because I'm very pleased with all the results, and you should be too. Alright? Thank you so much. Okay. Have a good day. Bye-bye.